On Good Morning America, they had a segment on a study done by Match.com, and it was a pretty simple study, and they were just looking at characteristics of people and what people found to be attractive. And what they did discover was that the most important characteristic that people found to be important was their teeth.
How I look and how I present is important. That I look sort of confident and attractive and like I've got myself together.
Your smile affects everything you do. I deal with clients. I speak in public.
I just wanted to have a perfect smile, or as perfect as I could get.
I had waited so many years to have this implant done, and I wanted it perfect.
There's really no specialty of cosmetic dentistry, because all dentistry should be aesthetic as well as cosmetic.
As a prosthodontist, I'm a specialized dentist with advanced training in oral health issues. After dental school, we complete a residency program. In our case, it's a 3-year program after dental school in which we get trained to deal with the most complex patients with the highest aesthetic demands.
Creating aesthetics for a patient really involves an opportunity to potentially enhance their appearance. Now, enhancing the appearance means complementing their appearance as well.
So you can see what we can do with porcelain veneers, and porcelain veneers are a very conservative option. You watch TV and you see people with big white teeth, and so people think their teeth need to be big and white.
We want to see teeth that are symmetrical. We want to see teeth that match the shape of someone's face. We want teeth that are proportionate to somebody's appearance.
And there's no bleeding on probing.
Healthy teeth can be lightened, not necessarily whitened, which means you're taking it brighter, you're making it lighter color.
A lot of our training is focused on the oral facial aspect of that patient.
She sat down with me, watched me talk.
She would actually make me smile all different ways just to make sure my smile was perfect.
Matching a smile to the patient's individual personality is probably one of the hardest things to do and really one of the hallmarks of the specialty.
Right down. Okay, could you move your jaw to the left side? The teeth, the bite, the gum, the jaw relationship, the jaw movement has to be harmonious with each other.
As a prosthodontist, we measure a lot of different times before we actually initiate treatment.
It was kind of the difference between buying clothing off the rack or having something custom made for you.
We do procedures that can be basic, from one single crown to implants, dentures, a combination of implants and dentures.
When you're young, dentistry is basically about avoiding cavities. And as you get older, you find out that's actually the least of your problems.
A lot of the baby boomers are interested in implants. Well, they're at the age now where their restorations that they've had, such as their crowns or caps, may be failing.
I wanted an implant instead of my crowns, and I had a broken tooth on the bottom too.
We are going to do veneers and some crowns, 6 on the top and about 6 on the bottom.
Are you excited?
I am.
We are highly trained dentists, and when people are seeking the best in dentistry, they should be seeking prosthodontists.
I know I'm making an investment in avoiding real problems in my future.
It was not about the time, it was not about the money, it was about doing it right.
I don't know why I'm one of these people that talk about that I have an implant, but maybe it's just because I'm happy with the results.
Oh, it makes me feel great. I mean, I can go into my 50s knowing I don't have to do anything with my teeth.